Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's now understand the classification of anticoagulants. So, anticoagulants and its classification. So, the first one we look at the vitamin D antagonist. So, you have the vitamin K antagonist. So, under the vitamin K antagonist, we have the warfarin. So, there is warfarin. Next, moving on, there is the direct thrombin inhibitors, and we shortly known as the DTI, the direct thrombin inhibitors. So let's write thrombin. So direct thrombin inhibitors, it includes the parenteral, the bivalent, as well as the oral. So first one is the parenteral. So under this parenteral, there is a monovalent DTI, that is a argatroban. So monovalent DTI, that is the argatroban. Next is we move on to the bivalent. So under bivalent, it includes the DTI. Bivalent DTI is the lepirudin, desirudin, as well as the bivalrudin. So lepirudin. Next is the desirudin, and next one being the bivalrudin. Now, after this, there is also the oral group of drugs. So under this oral group of drugs, it includes the dabigatran. So there is something known as a dabigatran. The next is, so this was the direct thrombin inhibitors. Next we move on to the indirect thrombin inhibitors. Indirect thrombin inhibitors. So under this indirect thrombin inhibitors, it includes unfractionized heparin. So it's unfractioned heparin, unfractionated heparin. Then comes the low molecular weight heparins. Low molecular weight heparins. So under this low molecular weight heparins, it includes the enoxaparin, dalteparin, tinzaparin, as well as the natroparin. So there is the enoxaparin. There is also the dalteparin. Next is the tinzaparin, as well as the natroparin. Next we move on to the indirect factor 10A inhibitors. So let's look at the indirect factor 10A inhibitors. So this indirect factor 10A inhibitors, it includes a fondaparinux. So there is the fondaparinux. Next is the oral direct factor 10A inhibitors. So oral direct factor 10A inhibitors is rivaroxaban, the apixaban, the edoxaban, as well as the betrixaban. So what is common here? The XA is common. So rivaroxaban. Next is apixaban, the edoxaban, as well as the betrixaban. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.